Hi everyone and welcome to the CPR video. You're going to watch this video and answer the questions embedded throughout. Then during faculty meetings you will show me your skills, the skills of conscious choking, unconscious choking, CPR and AED. The goal is to have everyone feel comfortable if they ever have to use any of these skills. So if you have any questions at all, please don't hesitate to ask. And a special shout out to Sarah for all of her help helping me make this video. Thanks so much, and I hope you enjoy it.
Keep coughing. Are you choking? Someone call 911. He's choking. May I help? I know what to do. Lean forward.
When a conscious person can no longer cough, speak, or breathe, he may be choking. We give back blows and abdominal thrusts to help push the object out of the airway.
We've just confirmed that a person is choking, and he's given me permission to help. Use back blows first to help dislodge the object from the airway. Using the heel of your hand, give 5 forceful back blows between the shoulder blades. Each back blow should be a separate attempt to get the object out. If the 5 back blows do not get the object out, give 5 abdominal thrusts. You can follow along here, but again, do only what I tell you to do. Stand behind the person. Use one hand to find the navel. Make a fist with your other hand and place the thumb side of your fist against the middle of the abdomen, just above the navel. Got it? Now that you have your fist in the right place, grab that fist with your other hand. This is the position you want to be in to give 5 abdominal thrusts. Pull upward, quickly, with each thrust. Each thrust should be a separate attempt to force the object out.
Continue giving 5 back blows and 5 abdominal thrusts until the object is coughed up, until the person starts to breathe or cough forcefully on his own, or until the person becomes unconscious. If the person loses consciousness, gently lower him to the ground, taking care to protect the head all the way down.
Check the scene for safety. Check the person.
Are you okay? Are you okay?
Call for help.
Call 911. He's unconscious.
If the person is face down, roll him onto his back. Open the airway, look, listen, and feel for signs of life for no more than 10 seconds. There are no signs of life. Give 2 rescue breaths. Learning how to open an airway is vital because if the airway is blocked, the person can't breathe. The airway is the path that air travels to get from the nose and mouth into the lungs. When an unconscious person is on his or her back, the tongue relaxes and falls back into the throat. This can block the airway. Tilting the head back and lifting the chin pulls the tongue away from the back of the throat and opens the airway.
Breath, breath.
Quickly scan the body for severe bleeding as you get into position to begin CPR. Your body position, hand placement, and timing are all important aspects of doing CPR correctly.
First, place the heel of one hand in the center of the chest along the breastbone. Then, place your other hand on top and lace your fingers together. Your shoulders should be directly over your hands. Keep your arms straight and your fingers up off the chest. Press down on the chest, then let the chest come all the way up, like this. Down, up, down, up.
When you press down on the chest, press down about 2 inches deep, about this far. And be sure that after you press down on the chest, you let the chest come all the way back up before you press down again. When you come up, don't take your hands off the chest. Just take your weight off the chest. These repeated down and up motions are called compressions. The down and up of each compression should be a smooth motion. For CPR to be effective, compressions need to be fast. 30 compressions should take about 18 seconds. I've set this metronome to that pace. Now I want you to watch Connie do 30 compressions at this pace. Keep in mind, this is how fast you need to do compressions in a real-life situation. Connie, I'll give you a countdown. Ready? 3, 2, 1, go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10 and 11 and 12 and 13 and 14, 16 in, 17 in, 18 in, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
CPR is performed in what we call cycles. One cycle of CPR includes 30 compressions, just like you've already practiced, followed by 2 rescue breaths. Each breath should last about 1 second. Watch for the chest to rise with each breath. The cycle is then repeated, 30 compressions and 2 breaths, 30 compressions and 2 breaths. Check the scene for safety. The scene is safe. Check for consciousness.
Are you okay? Are you okay?
There is no response. Have someone call 911.
Call 911. This child's unconscious.
Open the airway. Look, listen, and feel for movement and breathing for no more than 10 seconds. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000. There is no breathing. Put your breathing barrier in place and give 2 rescue breaths. The breaths go in. Check for a pulse for no more than 10 seconds. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000. There is no pulse. Position your hands in the center of the chest. Shoulders over hands. Begin CPR. Good job. Now you know how to do CPR for a child. You know that your hand position, body position, and speed are all important to perform CPR effectively.
You may need to do CPR for several minutes before help arrives. You should continue CPR until you find any obvious sign of life, until an AED is ready to use, until EMS or another trained responder arrives and takes over, until the scene becomes unsafe, or until you are too tired to continue. Without oxygen, the body may suffer permanent damage within just a few minutes. Breathing for someone else is called rescue breathing. Your rescue breaths provide enough oxygen to sustain life. To perform rescue breathing, keep the airway open. Give 1 breath about every 3 seconds.
1 1,000.
Watch the chest clearly rise and fall with each breath.
1 1,000.
Avoid breaths that are too hard or too long because they can cause air to go into the stomach instead of the lungs. After 2 minutes of rescue breathing, about 40 breaths, remove your breathing barrier and recheck for signs of life and a pulse.
Welcome back. Now that you're comfortable with performing CPR, we're going to show you how to modify CPR to care for an unconscious person who is choking. If your breaths do not go in, something may be blocking the airway, and the person could be choking. We call this an obstructed airway. You've got to clear the airway immediately so the person can breathe. An open and clear airway is the priority. You can use a modified CPR technique to help clear the airway. First, let's talk about the steps you will add to CPR. Watch Connie. If at any time during your care your rescue breaths do not go in, you might not have tilted the head back far enough. Reposition the airway by tilting the head farther back. Pinch the nose shut and give the 2 rescue breaths again. If the breaths still do not go in, assume the airway is blocked. Remove the breathing barrier and give 30 chest compressions.
1 and 2 and 3 and 4 and 5 and 6 and 30.
Now here's the other step that is different. Between compressions and breaths, you open the person's mouth and look inside for an object. But because we're not practicing on a real person, Connie will need to modify certain aspects of this skill for use on a mannequin. First, watch this animation, which shows how to open a person's mouth. Grasp both the tongue and lower jaw between your thumb and fingers, and lift the jaw. We don't want you to put your fingers in the mouth of the mannequin, so just lift up on the chin, as Connie is demonstrating here, and look for any object that might be blocking the airway. Try not to move the person's head around as you look inside the mouth. If you can't see an object, replace the breathing barrier, open the airway, and try 2 more rescue breaths. If the breaths still won't go in, you would continue the cycle. chest compressions, look for an object, and 2 breaths until you can make the chest clearly rise with the rescue breaths. Let's all try opening the mouth and looking for an object. We'll pretend that you've just finished the chest compressions, so your barrier should not be on your mannequin. I'll tell you what to do. Ready? 3, 2, 1, go. Grasp both the tongue and lower jaw and lift the jaw. Look for the object. You do not see an object. Replace the barrier, open the airway, and try the 2 rescue breaths again. Good. You can let go of the mannequin. If the breaths did not go in, you would have continued with compressions to try to get the object out. But for now, we're going to practice what to do if you see an object when you look in the mouth. First, don't put your finger into the mannequin's mouth. Instead, as Connie is demonstrating, move your finger outside the mannequin's cheek to represent your attempt to get the object out. In reality, removing an object with a finger will look more like this. Now it's your turn to try looking for and removing an object. I'll tell you what to do. Ready? 3, 2, 1, go. Open the mouth and look for the object. You see something in the mouth. Use a finger to get the object out. Try to give 2 rescue breaths. The breaths go in. Check for signs of life. 1 1,000, 2 1,000, 8 1,000, 9 1,000, 10 1,000. Good. You can use a modified CPR technique to help clear the airway. First, let's talk about the steps you will add to CPR. Watch Connie. If at any time during your care your rescue breaths do not go in, the airway may not be positioned properly. Reposition the airway by returning the head to a neutral position, then tilting the head again. Pinch the nose shut and try the 2 rescue breaths again. If the breaths still do not go in, assume the airway is blocked. Remove the breathing barrier and give 30 chest compressions.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now here's the other step that is different. Between compressions and breaths, you open the child's mouth and look inside for an object. But because we are not practicing on a real child, Connie will need to modify certain aspects of this skill for use on a mannequin. First, watch this animation which shows how to open a child's mouth. Grasp both the tongue and lower jaw between your thumb and fingers and lift the jaw. We don't want you to put your fingers in the mouth of the mannequin, so just lift up on the chin, as Connie's demonstrating here, and look for any object that might be blocking the airway. Try not to move the child's head around as you look inside the mouth. If you can't see an object, replace the breathing barrier, open the airway, and try 2 more rescue breaths. If the breaths still do not go in, you would continue the cycle. 30 chest compressions, look for an object, and give 2 breaths until you can make the chest clearly rise with the rescue breaths.
13.
Let's all try opening the mouth and looking for an object. We'll pretend that you just finished the chest compressions, so your barrier should not be on your mannequin. I'll tell you what to do. Ready? 3, 2, 1, go. Grasp both the tongue and lower jaw and lift the jaw. Look for the object. You do not see an object. Replace the barrier, open the airway, and try the 2 rescue breaths again. Good. Every year, thousands of people die of sudden cardiac arrest. Many of these deaths could be prevented with immediate and appropriate care. Remember the cardiac chain of survival. Early recognition and early access. Early CPR. Early defibrillation, and early advanced medical care. Technology is available to help you provide early defibrillation for cardiac emergencies.
These machines are called Automated External Defibrillators, or AEDs for short. An AED is a portable device that analyzes the heart's rhythm and determines if an electric shock is needed to help restore an effective rhythm. An AED can deliver that shock either automatically or with the push of a button.
An AED is not a replacement for CPR or quick activation of the EMS system. Always give CPR until an AED is ready to use.
You still start out, as always, with the emergency action steps: check, call, care. If, during your check, you find no signs of life, assume that the heart is not functioning properly. Make sure someone has called for help and use the AED immediately. If an AED is not available right away, give CPR until an AED is at the scene and ready to use. First, turn on the AED. Some turn on as soon as you open the case. This model has a power switch. Pay careful attention to the voice prompts. They will tell you what to do next.
Apply pads to patient's bare chest.
Remove the pads from their packaging so they're ready to use. The person's chest must be bare and dry. Use a cloth to dry the skin if it is wet. Apply the pads to the bare, dry chest. Place one pad on the upper right chest and the other pad on the lower left side. Some pads have illustrations that show correct placement. On some models, the pads and cables are already connected to the AED.
Plug in pads connector next to flashing
If yours are
light.
not, be sure to connect them only after you apply the pads to the chest. Once the pads are applied and the cables plugged in, the AED should automatically start analyzing the heart rhythm.
Analyzing heart rhythm.
For the AED to operate properly, you must not allow yourself or anyone else to touch the person while the AED is analyzing.
Analyzing heart rhythm. Do not touch the patient.
Analyzing. Everyone stand clear.
On some models, you may need to push a button to analyze the rhythm. It is also helpful to repeat instructions and warnings out loud so bystanders do not touch the person while you are operating the AED. The sequence will look something like this.
Analyzing heart rhythm. Do not touch the patient.
Analyzing. Everyone stand clear.
Shock advised. Charging. Stay clear of patient.
Before you push the button to deliver the shock, make sure no one is touching the person, not even you.
Deliver shock now. Press the orange button now.
Shocking. Stand clear.
Shock delivered. It is safe to touch the patient. Begin CPR.
1 and 2 and 3 and 4 and 5 and 6.
After a shock is delivered, or if no shock is indicated, give 2 minutes of CPR before analyzing the heart rhythm again. If no shock is indicated after the second analysis of the heart rhythm, continue CPR for another 2 minutes before analyzing the rhythm again. If at any time you notice an obvious sign of life, stop CPR and monitor the ABCs. The AED tells and shows you each step of the way what is happening and what to do next. It's very important that you make sure no one touches the person while the AED is analyzing or delivering a shock. That includes you.
Call for help now. Remove clothing from chest. Peel each pad off blue plastic and apply pads to exposed chest.
Remove the pads from the packaging. The child's chest must be bare and dry. Use a cloth to dry the skin if it is wet. Apply the pads to the bare, dry chest. Place one pad on the upper right chest and the other pad on the lower left side. If the child is very small, the pediatric pads may touch each other. To prevent the pads from touching, place one pad on the child's chest and the other pad in the middle of the back.